Hello everybody and welcome back to my channel. So as promised, in today's video I am going to be talking about how I can better help you to pass your medical assisting exam through the Ncct. So without further ado, let's just hop right on into this video. Alright, so for starters, I just want to say all of that I had to study for my Ncct was the website ncct.inc.com, and I purchased the review module along with the practice exam, and it was $49.99 and it is good for an entire year. And all I had was this and previous medical experience working in a medical facility and also going to school for it. That is all the knowledge that I went into my exam with. If you have previous knowledge, of course, that'll always be beneficial to you. If you have outside resources, definitely use them. But all I'm going to be talking about in this video is how this website and the review module along with the practice exam will help you in preparation for your Ncct. So first things first, I recommend you take the preliminary sample quiz. All it is 50 test questions. It is self-paced. Do it on your own time. And it gives you a score, and then it focuses on areas that you should study the most. And then after the preliminary sample quiz, I recommend going into the detailed test plan. And once you are in the detailed test plan, it gives you 3 levels of questions that will be on the actual exam itself. And then it goes into each content category and tells you how many of that subject will be scored, and then it gives you what you should focus on. So if you go into pharmacology, it gives you consult pharmaceutical references to check medications, perform basic medication related calculations, comply with the DEA, and all that fun stuff. All right. And then it goes on to medical procedures, phlebotomy, ECG, and other diagnostic tests. Excuse me. General office procedures, medical office general management, office financial management, billing, insurance, and law and ethics. So that is just for the detailed test plan. So right now what I'm going to do for you is I'm going to go into the interactive review, and I'm going to go through each and every single one of these sections and tell you certain areas that you could focus on to aid you better. So communication is the first section that we will be going into. So when it comes to communication, you need to know how to talk to your patient. You need to know if your patient is displaying anger, denial, if they're sad, what you need to do as a medical assistant to comfort them. And also, if there's a language barrier, what you should do as a medical assistant. So I'm going to give one question through each of these subjects so that you can just grasp an understanding of the types of questions that will be on the exam. A patient calls the office concerned because they have been stung by a bee. Which of the following shocks should be your concern? Psychogenic, hypovolemic, anaphylactic, or septic? And then when you click the correct answer, never wants to work, and then what it does is it pops up green, telling you that you're correct, and it gives you the rationale. If it is wrong, it will pop up red, give the correct answer and the same rationale. So like I said, when it comes to communication, know how to talk to your patient. If a patient calls over the phone, what you should be doing. Even if a provider calls, how you should be handling that information of communication. So next, we will be moving on to ECG placement, techniques, recording, and interpretation. So when it comes to this section, know the leads, know where the leads go, and if a patient I'm trying to think of how to word this question. If a patient has something on their left leg, or something happened to that patient's left leg, like let's say they have a cast and you can't put the lead there, where are you going to put that lead? If you can't put it in a certain location, where would the next best location be for that lead? Which of the following are appropriate actions for the ECG technician to take when placing electrodes on a patient's skin for a 24-hour Holter monitor? So you need to know what you need to do to prepare that patient's skin to get the leads on them. What equipment, if needed, that you will need for preparation of the skin. And then for recording and interpretation, it will give you like a question saying a patient's reading shows this, what will it look like? And it will give you different test strips showing you, and you will have to know exactly what, that was a mix between which and what, have to know what it is talking about. Like if it's atrial flutter, what it will be showing. If it's normal sinus, what it will be showing. Also, you will need to know if you have a patient who is moving, what happens to the interpretation, like where will you see that go on the strip. If you have patients who are shaking too much, how you should help these patients and what you should do for these patients to get a correct, I shouldn't say a correct, but a normal interpretation for that patient on the test strip. The difference if you have just a normal adult versus like a pediatric patient. What should be the difference in how you're prepping the machine for that? So ECG troubleshooting and maintenance. To prevent wandering baseline artifact, the medical assistant should ensure the patient is, and then you'll select the right answer. So also it will show you, why did I get out of it? Show you pictures of test strips, and you will have to know exactly what it is, along with, if it's telling you exactly what it is, what will the test strip look like? It will show you a test strip and be like, what is causing this? And you need to know exactly what is causing the test strip to look like that. Infection exposure control and safety. So when it comes to this section, which of the following statements by the medical assistant indicates the need for a better understanding of standard precautions? So definitely know your standard precautions, know your PPEs, know which PPE you will wear with certain infections or diseases for the patient. When it comes to infection control, what should you do? What is the best way to prevent the risk of infections? And also needle sticks. So if you are stuck by a needle, what should you do if not only yourself, but the patient is also stuck in the process? What should you have done? How should that have been prevented? And what is your next step after? And of course, no OSHA. They're the biggies with infection control. Also know like your signs when it comes to like biohazard or radiation, all sorts of fun stuff. Okay, so the next section we are moving on to will be law and ethics. Legal responsibility for an act or occurrence refers to which of the following? So that's a sample question. No ethics, of course. Know your morals. No assault, battery, libel, slander. Know what needs to be done if somebody calls over the phone and they're requesting a patient's medical records. If a patient's significant other or a friend of the patient comes in and is requesting that patient's medical records, what do you need to do and what should be done? Hello. Or if somebody's medical records get subpoenaed, what is the correct course of action for you to take? Medical office computer applications. Which of these is a safeguard that is put in place to help secure access to EHR information? So in this case, no SOAP, no like the SOAP system, no cheddar, so much fun, no the types of filing systems that are used, if they're just alpha, if they're alphanumeric. I'm trying to look at another question. Know how to safeguard your patient's records. If you're stepping away from the computer, what are you going to do? Okay, the next is medical office general management. Which of the following statements describes managed care? For the medical office computer applications, medical office general management, medical records, and office financial management, billing, and insurance, to be honest, they technically all run into one another. And if you read the questions, they are similar in the topics. So I'm just gonna continuing off of where I was at for the medical office computer applications. I will include medical office general management, medical records, and office financial management, billing, and insurance. So this is just going to be all one topic to discuss every single one of these. As always, going off, know how to protect your patient's medical records, what needs to be done. For billing and insurance, make sure you know what needs to be filled out when you are billing for a patient's insurance, whether they need an authorization or if it's a referral that they're needing, what information needs to be filled out, not only by the medical office, but by the patient in order for the physician to receive payment, what needs to be filled out if the patient is getting a procedure done at the hospital, what form needs to be completed, know the types of insurance when it comes to Medicare, Medicaid, TRICARE, know workman's comp, and also know if the patient needs medical grade equipment, where are you going to be looking for the codes for medical grade equipment. Know the difference between an ICD code and a CPT code. It will tell you like a patient is getting da-da-da-da-da or doing da-da-da-da-da or has da-da-da-da-da, and then it'll give you literally a CPT code, an ICD code, the HCP, I can't remember the actual acronym for it, but the medical grade equipment code. It'll give you all the codes and you have to select which one is the correct one. What you should do if the computer goes down or the printer goes down, what you should like be looking for. Like you're trying to scan something, but nothing is happening. printer is full of paper, the cartridges are normal, everything is normal. What should you be looking for? Okay. So that is all I can think of to help you in those sections. All right, so the next topic is other diagnostic tests. A medical assistant is responsible for performing which of the following quality control measurements? And I'll give you another one. Which task should a medical assistant complete prior to using a POCT instrument? I'm just trying to... the agency that regulates physician office labs is. So definitely know the CLIA, know which tests medical assistants can perform, all the wave tests that they are allowed to perform. Know if the physician is going to be doing some sort of procedure, what procedure it is and what instruments that physician will need. When it comes to cleaning instruments, what should be done, and how you should educate the patient when performing certain tests that they will be taking or that you will be administering. Patient care. So when it comes to patient care, I want to say that's definitely a give me. So to give you an example, a patient has a pulse ox reading of 88% on room air. Which of the following conditions does this reading indicate? And another one, in which position does the medical assistant assist the patient into just prior to a pelvic exam? So definitely know the positions that you will place certain patients in, whether it be for a pelvic exam or it be for getting just a regular, I'm trying to word this question because it was an exam question. It's kind of like a patient is going to be getting a certain procedure done, but they are having issues breathing. What position should you place them in to aid them? Yeah. I didn't want to say the question exactly, but yeah. So anything else that I can think of for patient care is definitely, like I said, give me just, it's the longest section in the study module. Next is pharmacology. You want to know the brands of the medication. You want to know the routes that medications are taken and why they are taken that way. You need to know just going off of why it is taken in that route, especially when it comes to giving an injection. Why is that injection given in either sub-Q versus IM? You need to know, of course, your dosage calculations and any adverse side effects that a patient may encounter. And I think that is, for the most part, yeah. Oh, or if a patient brings in a medication, but let's just say they only have like one pill, it's like, ooh, I don't know what medication this is. I don't remember what it was. How will the medical assistant go about finding exactly what medication that is? And also, what if it's like a controlled substance, if it has the high possibility of being an addictive medicine, know those. And also the DEA, you know that in regards to the DEA when it comes to controlled substances, and that the provider will need narcotic. I'm having a brain fart over what it's called. But know that, yeah. Oh, and how you would go about like disposing medications. Phlebotomy is the next section. When it comes to know it all when it comes to phlebotomy. Of course, order of draw, know what the tops mean, know what additive is in each color, why that additive is in it, anything to do with tourniquets, yeah, just when it comes to phlebotomy, seriously know everything. That is, I know that kind of sucks, but that is literally know everything. But I'm going to give you a sample, of course. Which of the following steps is completed first in performing venipuncture? Identify that patient. Okay. Scheduling. I don't recall too many scheduling questions, and my thought process is when in doubt, select a wave. But I don't know if that was the case and if that was the right answer for my test question on the actual exam itself. So definitely know the types of scheduling. And then the only question that pops off the top of my head is you have a provider who is splitting their time in 2 separate locations. How should you go about scheduling those patients in those 2 separate clinics? Yeah. All right. And that is everything, especially off the top of my head, that I can think of to aid you into passing your Ncct exam for medical assisting. I do recommend purchasing this review module because it comes with the review module and a practice exam for only $49.99, which is a huge help. And of course, any outside sources that you have or would like to use, it's only going to benefit you in the long run. So with that being said, I hope this video helped you in any way, shape, or form that it could. If you're getting ready to take your exam, I wish you the best of luck. I know you will pass and you will do great. If you do have any questions, comments, or concerns in regards to your upcoming Ncct exam or just anything you want to ask, please feel free, drop it down below, let me know, and again, you will do great. So until then, I will see you guys in the next video. Bye guys.